Hi, I'm Dr. Andrea Sunholm, one of the surgeons here at Dev Lewis, and we are watching a patient right now that we have applied leeches to. So this patient approximately 5 days ago had a mass removed from his leg, and what we are starting to see is that the site from the flap became dark, and we were concerned about venous congestion. And so therefore one of the medical treatments for venous congestion in this type of scenario is to apply leeches. And so we are able to order these as medical grade, and we were able to get them overnight and apply them to this patient. So basically what we've done is this patient is sedated, and we've picked about 5 leeches for this site just based on the size of the area. One leech can do about 2 centimeters squared. So we've applied 5. They've been on probably for about 10 minutes. Each leech can absorb 5 to 15 mils of blood. And so basically what we're watching for is we don't want them to migrate onto normal skin. We want them to stay on the affected area. So once they have been applied, they'll attach themselves and begin to remove the congested blood from the patient. And then once they've finished their meal, they will fall off. We have plans to do this treatment with the leeches a few times over the next couple of days. So there's 5 right now. We plan to do this treatment 3 more times. Basically, the leeches are kept in a special saline solution while we are between treatments, and then once the leeches fall off, there's a special way to dispose of them, but they're a one-time use on a one-time patient. Something to keep in mind if once you are applying the leeches, if they don't attach to the site, either the tissue there might be dead, or there's other reasons that the leeches aren't going to work, like for just edema, which actually isn't going to be a recommended therapy for these. So if they're not attaching, the recommendation is either to put a little pinprick in the skin so there's actual blood there, or just make sure you have the correct diagnosis of why you're using them.